Hi, my name is Jennifer King, and I'm the president-elect of the Dallas Women Lawyers Association. And I'm very happy to be here today with Maria Ganson, Vice President and Deputy General Counsel for CHRISTUS Health. I am lucky enough to not only know Maria personally and be a friend of hers, but also have her as a client. And so welcome, Maria. Thank you so much for giving us time this evening to talk to the members of DWLA about your job and also how COVID has affected not only you personally in your job, but also your ministry, which is how y'all refer to your individual hospitals. So why don't you talk to us a little bit about, well, you know, before we do that, what I want to do is I want you and I to just briefly talk about how we met, because I think that's a pretty good story and a lesson on professionalism and something that I think everybody ought to take to heart. So why don't you just spend a few minutes telling everyone how we met?
Sure. We met probably 20 years ago when we were, 3 and 4 respectively. No, we were starting our practices, and we were both representing healthcare providers. And I think we met in a deposition, which in our practice, we take hundreds of those a year. And I remember just, you probably had the doctor and I had the hospital, or vice versa. And I just remember what was unique about when we first met was that within the scope of that case, we also got to be pretty friendly with the plaintiff's attorney, another woman attorney, who the three of us have kept friendship for 20 years. It went way beyond that case, and you and I are still in touch all the time. So it was a pretty unique start to a friendship and a professional relationship, I think.
Yeah, and it was a deposition, and I remember we were all three talking about on a break what we were reading. And then we very shortly thereafter started a book club together because we found out that we all liked reading and we liked the same types of things. And what I love about that story is that relationships, I think, are the cornerstone of a successful law practice. And I think it helps to get along with opposing counsel. I think it helps to definitely get along with your co-defendants and in litigation. And because, not only is it helpful in the case, I think, and helpful to everybody's clients, but you never know where people are going to be 20 years from now. And it just so happens that my really good friend also is now Deputy General Counsel of a major healthcare corporation. I'm lucky enough to do some of your work. So let's talk about how you got from a successful law practice, like a lot of the people who might be listening, to in-house counsel.
Well, health law was really my passion coming out of law school. I started with a very small firm in Dallas that did Presbyterian work before CHRISTUS even came to be formed, and that led to working for Cooper and Scully eventually, which is a predominantly medical malpractice coverage law firm. And I think that's kind of the time frame where you and I met. Had children, got married, and a litigator's life is pretty busy with small children. But made that work for many years. But about 13 years into the job with Cooper and Scully, I was approached about going in-house for CHRISTUS Health. And CHRISTUS Health isn't a hospital system that you see in the Dallas-Fort Worth area. It was formed in, it actually has a very long history. It's been in Texas since the 1860s, when the Sisters of the Incarnate Word established themselves in Galveston in 1866. And CHRISTUS was a very large presence in Houston and in San Antonio from really that time frame. But in 2000, CHRISTUS itself was formed as a corporate nonprofit, bringing together the Sisters of the Incarnate Word of Houston and San Antonio into what is now CHRISTUS. In 1999. And in 2014, our CEO moved the corporate headquarters to Irving. And that's about the time that I was approached to consider coming in. And it was a little bit of a change, as all of us who are in private practice, coming into a corporate setting. I'd never worked in a corporate setting before. It was a little bit of an adjustment. And to go from handling a docket of, a private attorney might handle a docket of 13 to 25 active cases. Suddenly I was responsible for all litigation for 60 hospitals. And, somewhere in the 300 to 400 active matters were on my desk. And that was a little bit of an adjustment, but it really I've been there a little over 6 years. I have a large team that does the majority of the work. I have nurses, I have attorneys and paralegals, and it's fulfilling every day. It's no 2 days are ever the same, and COVID has certainly brought some change, and we'll talk about that. But really, it's been a nice progression of my career. It was where I think I was always headed, and it came at the right time. So it's been a great ride, and I'm having a very every day I learn something new, and I think that's really what's fulfilling about our careers. I know as a med mal lawyer, every day you learn something new. You certainly learn some new body function or a surgical procedure with a new case. And so I'm always learning. And as long as I'm learning, I'm happy, I've discovered. And so it's given me that opportunity.
Well, and you talked a little bit about, your job day to day pre-COVID. Why don't you tell us and I know no 2 days are ever the same with what you do, but tell me about kind of your typical day or week pre-COVID.
Well, so I wear essentially 2 to 3 hats now. I am Deputy General Counsel, which means that I report to our General Counsel and Chief Legal Officer, Jeannie Fry, and help her manage a 16 attorney, 6 paralegal, multiple staff legal team. And we also have, we have 60 hospitals in the United States and Latin America. So we have hospitals in Mexico, in Chile, and in Colombia. I'm bilingual, so that came in handy. But with that complexity of structure, we have a lot of lawyers doing a lot of really great work all the time. And so my job is predominantly to oversee a few of the lawyers, the employment lawyer, the lawyer that specializes in managed care, and our clinically integrated network, our CINs. And in addition to that, I oversee the team that oversees litigation, and we oversee all professional and general and commercial litigation. I don't oversee employment litigation. That's dedicated to a specialist, Keitha Wright. And so every day we do everything from get every service event for 60 hospitals and 350 separate clinics and provider entities, which is a constant source of activity, to managing 300 to 400 matters in litigation. And so no 2 days are the same. I don't get the benefit of getting to sit in deposition anymore, which I miss in some ways. But I do, Zoom has changed a little of that. I have been able to Zoom with some hearings of significance. I do attend mediation. I think that's probably my largest job responsibility now, is to attend mediation and make decisions on behalf of our insureds. So it's varied. No 2 days are the same. And before COVID, I was pretty heavily traveling for mediation, and since then I've really not traveled since March. But that's kind of an idea.
So tell me, and I'll tell you, I remember you and I were talking because I was traveling in Texas in March to your ministries, in some of them in South and then also in East Texas, when right pretty much on the day the order came, like, we're shutting things down. And I remember being in East Texas and saying, oh no, I've got to get back to Dallas. I've got to get back to Dallas. And then so we started talking about how we were going to handle our lawsuits once once COVID hit, and we just started really learning about what it was going to mean, not only for your ministries, the hospitals themselves, but also just for the cases. So talk to me a little bit about how COVID has changed both for your litigation caseload as well as for the ministries, and how that impact has changed your practice.
Well, we pretty early on, we knew our primary job is to make sure that our providers are not drawn into depositions or any type of litigation obligation. They're your puppies. That would take them away from delivery of care, which is always true for our providers, but it became a bit more critical given the fact that, for example, if we have an emergency room case, we didn't want our emergency room nurses taking, time out of their schedule to prepare and have to go to meetings with attorneys. So very quickly, we got a letter out to all of our defense counsel advising them that because of the surge or the first stage of COVID, which was a very busy stage in March, April, May, we pretty much put the clamp down and said, we're not going to do depositions of providers. We are going to try to comply with your discovery requests, but our risk managers were stretched in terms of all the hats they wear, in terms of helping with staffing and helping with PPE and helping with just managing the crisis in general. So we didn't want to put a burden on them. And so I think that letter, for the most part, I don't remember any of our 25 defense firms saying, hey, this plaintiff's attorney is going to move to compel because you're not willing to do depositions in this time frame. I think for the most part, that position was honored, and I'm grateful to the trial bar for honoring that. It's changed a little bit since then. We were able to go back to deposition activity, but it's all been on Zoom for the most part, because hospitals have, if you don't have visitation for family members of the patients, you're certainly not going to want attorneys coming in to meet with staff. So everything's been handled via Zoom, and depositions have been handled via Zoom since then. Just today, however, Jen, we listened to the governor of New Mexico. They are going through a significant surge right now. They're the highest in the country.
Oh,
and so for our cases there, I think tomorrow we'll send another letter to re-request that we respect the fact that our caregivers are being called to the bedside more than to a deposition, and that we're going to have to again ask for some grace and some understanding in terms of deposition activity with our care providers for New Mexico right now, given that they're back in a difficult crisis period. So it's ebbed and flowed. It's not like anything I've ever experienced in 29 years of law practice, but the graciousness of everyone involved in the cases has really warmed my heart. We've not had one motion where anyone has put up an opposition to us asking for those delays. And so I've been really grateful and very much surprised by how gracious everyone has been.
Yeah, that was my experience as well. In all of the cases that I was handling on behalf of CHRISTUS Health, the plaintiff's attorneys were, like you said, very gracious in allowing our healthcare providers to do what they do best, which is provide patient care.
Correct.
And, and then once we did proceed, we've been doing everything by Zoom. Talk to me about, and COVID has changed the way that we all practice, of course. And talk to me a little bit about things that COVID has allowed you to do that really you weren't being able to do as much before. I know you mentioned mediations. Tell me the impact it's had on your mediations, which you said was an important part of your practice.
Well, we are, our ministry, our mission is to extend the healing ministry of Jesus Christ. And our values are compassion and dignity, excellence. And so very often if we believe we need to do the right thing and find resolution quickly and prudently, we often want to go to mediation quicker than most, because we want to worry about the patient and the family. And I think Zoom has allowed us to do that, because I feel like mediators' schedules have gotten a little more open, because they don't have to worry about housing us in several conference rooms, or, the coordination that goes into that. I feel like we've really gotten some excellent mediations. The mediators both in Texas, Louisiana, and New Mexico, where I have to practice, have been incredibly careful, and so it's allowed us to do that. It's allowed us as counsel, as in-house counsel, to have access to conferences that we might not have had easily, because they're going to be teleconferences, and if we didn't want to have a teleconference, then somebody had to get on an airplane and fly out and meet with the expert or meet with co-counsel. In a matter of a day or a few hours, you can get a Zoom set up, and there you are together, able to be face to face. So I have a feeling this is one of the vestiges of COVID that will continue even when we have the ability to be in the same room, because it is so convenient. There's been some good from this process, I think.
And tell me about, I know that you, and I've had the awesome opportunity to get to know a lot of the members of your team.
Mm-hmm.
So tell me about how your team, now that I know a lot of them are working from home, you have them all throughout Texas, New Mexico, and Louisiana. Tell me how your team has managed to continue to work cohesively through COVID.
Well, we have we've had lots of change in the way we work as a team, because when you're in the same building together, or even in our circumstances, I have team members in other cities, in Tyler or in San Antonio or in Corpus Christi, but we've really set up a new type of cadence of meetings, I guess is the best way to describe it, where we've sort of and you can meeting yourself to death. I mean, you can get to the point where you meet just to meet. We don't do that, but at the same time, we've created a huddle, which is a hospital created event. Our hospitals all have safety huddles in the morning, which have proved to be very effective. So we huddle as a team now after COVID. We just have 2 huddles a week, one at the beginning of the week, one at the end of the week. And if there's not a lot to talk about, we wrap it up quickly, but it gives us time to kind of compare notes. What are you dealing with right now? What new lawsuit? Because I don't think litigation has slowed down through COVID. I think the pace of getting in cases has not changed for us. It's not increased or decreased, but that cadence of huddles has allowed us to really, come together as a team. And then you have the benefit of team members with children who are, learning remotely. They're able to be home with their kids. So I think it's just changed the way we all work, be it in law or any other profession, other than the frontline healthcare providers that have to be at the hospital. So I think we do our part in that we're very mindful of being home and being protective and wearing masks and just doing the right things so that our frontline staff, not just at our hospital, but all hospitals, can avoid the surges. And so I don't know. I think that might continue too. I know my team members like the working at home very much, because every one of them has said, I'm more productive. I feel more productive. I feel more able to schedule my own time around picking up my child at school or whatnot, but I am more productive. And I think that everyone has found that to be true with the schedule.
Yeah, I think that especially if people who had travel or traffic or, just the normal everyday things that, we all have, I know that I used to travel a lot more than I do now, and you did as well. And I do think that Zoom, or I do think that COVID kind of made us start finding alternative ways to communicate and using technology in maybe ways that we had been hesitant to try to learn to do. And this kind of forced our hand. I know my practice, with the Zoom mediations, Zoom hearings, Zoom depositions, Zoom meetings, it's changed. And there are certain things that I think that we'll keep just like you do. And then I think there are certain things, maybe like expert depositions, that I would probably rather do in person. Maybe there are certain ones that we could do remotely, maybe, the economist or,
right.
Like a pure damage expert, something like that. But what do you think about that continuing? About, what do you think things that are better, at least in person?
Well, I have a young attorney on my team that I'm training into MedMal, and I tell them two things. The single most important deposition in a case is the deposition of the standard of care and causation expert who is on the other side. And I struggle with having our attorneys, Jennifer King, doing that over Zoom, because there's some magic that happens across a table when you're really, that's where the metal hits the road and you're finding out what the exact issue is in their theory of the standard of care and breach and causation. So I do find I'm struggling with that. And I'm also struggling with the prospect of Zoom trials. We're hearing about it. We're hearing about it in New Mexico. Or, we were ready to go to trial in East Texas where it was going to be an in-person trial, but everyone was going to have a face shield on or not. And our providers, we had 2 physicians in that case, would not come to court without a face shield and a mask. And so suddenly think about that. They're the only 2 people in the courtroom that will be wearing a mask because they don't want to run that risk for their patients. And so they're going to look very different than everyone else in the courtroom that was not going to wear a mask. And so to me, it was it becomes a question of due process and sort of your rights to a fair trial. So I think it gets very complicated when you talk about expert depositions and trial itself.
Yeah, I agree with that. I think that all of the counties are trying to figure out how they can safely go to trial while still protecting people's rights. And obviously, you have ministries in places where there's general jurisdiction, and the courts may have not only civil cases, but they'll have criminal and family law cases as well. And so typically in those venues, the civil cases are kind of pushed, and, rightly so, behind criminal and a lot of the family ones. And so I think that it's just a big question right now as to when we'll be able to go to trial safely and with, either some form of Zoom and in person or however we're going to do it, and the timing of that. I think that's going to be very interesting over the next year, trying to figure that out.
Right, because the backlog is going to be enormous. I mean, you always hear about criminal backlogs, but our backlog is going to be significant. And some plaintiffs don't want to wait. There's families in need or plaintiffs' attorneys that are needing to keep the lights on. So I think that it's made for a fair amount of more movement towards mediation.
Well, so tell me, and this is, I'm going to be taking notes during this portion, but tell me what attorneys have done to help you. What have you found to be most of help, besides me, just every day?
Every day. Every day.
What have you found that your outside counsel has done great during this time? And then I'll ask you to talk to us about what we can do in the future to help you and other in-house counsel through COVID.
Well, not just litigation counsel, but y'all can hear my dog in the back.
Mine too. Mine already barked. I think my husband walked by.
All the firms that do all of the work for CHRISTUS, be it regulatory, transactional, any type of tax work. We have a whole group of excellent law firms that have done our work for very long. When COVID started, it was sort of the COVID news hour on our inbox because so many firms were offering seminars and webinars on the multiple regulatory waivers, the CMS waivers that came out almost daily and then changed, state, federal, local guidance. I think I called you at one point on a nursing home question and made sure we were consistent with Clay Jenkins orders. It was that willingness to be there for us and do what I call curbsides, which isn't, you're opening a file, Jennifer King, and I need you to take this case. It's just literally answering a phone or a text that says, we need this answer in the next 10 minutes because we want to get it right. And so that level of flexibility that we've had, that our counsel in in Louisiana and New Mexico as well, has been so appreciated because the landscape changed, particularly in April and May, daily. And so, and we as a legal team, and I'm sure it's true of all in-house counsel for all hospitals across the country, had some very long days because, you know, suddenly the regulatory environment with the waivers, it was entirely different. Credentialing became entirely different. Telemedicine exploded, and everything around that changed. You know, reimbursement changed, regulatory change, credentialing changed. And as in-house counsel for the healthcare arena, we were looked to give the answers on something where often the answer was, it may change tomorrow. So I think outside counsel really was there for us, and proactively would send us websites, webinars, lists, PowerPoints that were just designed to assist us in sort of maneuvering that landscape. And it was outstanding, and it continues to be.
Is there anything else that you can tell your outside counsel or you know, other attorneys who have, of course, in-house clients, how we can help in the future, continue to help, how you anticipate maybe the practice continuing to change?
I just, you know, continue to be good stewards of our health workers, you know, support, you know, smart practices around social distancing and mask wearing, support that, because in the end that trickles down and keeps our EDs and our COVID units less full of patients, and their days are shorter. So, you know, and support your in-house counsel. Be willing to do what I call those curbsides, because, you know, sometimes it gets super complicated. Do I need to open a file to get a question that I know Jennifer King can answer in 5 minutes because it's in her head? So be willing to do that. And I can tell you that builds great, good faith on our side, because we know you're willing to give us, you know, that kind of easy counsel. You know, I have a couple firms that are national in scope. And so if I have a question in New Jersey, I have one person I can text, and he will text me back in 2 minutes and find me a lawyer in New Jersey or in Timbuktu. But it's that ability to be flexible and be available that I think builds that kind of confidence in your outside counsel. And with that will bring, you know, a long, long relationship.
Well, I really appreciate the time that you've spent talking to me today. Any time that I get to have a good conversation with you is time well spent. And thank you so much for talking to us about your experience, not only from moving from a successful trial practice to in-house counsel, and also how your ministry works and your role within that ministry, and your time at CHRISTUS Health before and after COVID. We hope to continue this lecture series, or this you know, communication series next year. So if you are out there and you have a person that you'd like to see us interview, we'd love to hear from you. Or if you have a series of topics that you would like us to address, we'd love to hear them. So thank you so much again, Maria, for putting in the time to talk to me today. And thank you all out there.
Thank you. Thank you, Jennifer.